The following video will cover how DEXA determines the follow-up interval for high-risk patients according to the OHIP criteria. Note that the follow-up algorithm can be optionally configured in the DEXA interface at the bottom of the questionnaire. Simply choose Ontario to use the Ontario guidelines. Before we proceed, let's take a closer look at the OHIP guidelines. In the Diagnostic Radiology Procedures document in the bone mineral density section, you will see that in Ontario, patients are classified as high risk or low risk. There are three definitions for high risk patients. The first definition, it states the patient is high risk if they are at risk for accelerated bone loss, and in the absence of other risk factors, patient age is deemed not to place a patient at high risk for accelerated bone loss. The second definition indicates that if a patient has osteopenia or low bone mass, or osteoporosis on the current or any previous BMD testing, they are deemed to be high risk. The third definition indicates that if the patient has had bone loss in excess of 1% per year, as demonstrated by previous BMD testing, they are also high risk. DEXA will look at the major risk factors to determine if the patient is high risk or low risk. Major risk factors are added manually, though some of them are also automatically generated based on other responses in the questionnaire. For instance, fragility fractures, current glucocorticoid therapy, loss of height greater than 2 centimeters, or current and historical diagnosis of osteoporosis and low bone mass are automatically determined by responses within the DEXA questionnaire and with the information stored in the DEXA software. If there's a single risk factor present, the patient will be deemed to be high risk and the interval will be 1 year. In this example, you'll notice a major risk factor exists which would make the patient high risk. If no major risk factors are present and none are optionally added by the user, a patient will be considered low risk according to the Ontario guidelines.